Welcome to the Southern Vermont AHEC Let's Talk podcast, where we dive into the real conversations that matter to the next generation of health professionals. I'm your host, Peg Bolgioni, and today's episode is all about helping recent college grads, especially our Gen Z listeners, prepare for job interviews in the healthcare field. I'm pleased to be joined by some experts. Alysia Straw, Director of Health Careers Exploration with Southern Vermont AHEC, and Darcy Bixby, Director of the Windham Center Psychiatric Hospital, which is part of the Springfield, Vermont Hospital, who will share some strategies on what employers are looking for and how you can make the right first impression. Ladies, I'm excited to get this program started, so let's begin. All right, first question. What are the most common mistakes you see recent college grads make in healthcare job interviews, and how can they avoid them? So I don't know who wants to start. Alysia?
I will start. I will jump right at that one. I believe one thing, especially when I was at a recruiter and even as the director of health exploration here, the one thing is lack of research on where someone or a candidate wants to actually work at. Now, if you want to work somewhere, it's really important to understand what that role is that you're applying for. But not only that, also understand the organization, know where you're applying. I've had times where I would have an interview with someone, and as we're going through, realize they did not do their research. They did not know that we were a critical access hospital. They thought we were a nursing home. So just your basic research, I think it's really important, and that's what I've seen as a common mistake during interviews. Darcy, what I'm sure you've seen plenty as my counterpart helping me as a manager do some of these interviews. What did you experience?
So I think that one of the biggest mistakes that I see new grads make is when I ask about a particular skill. So we are an inpatient psychiatric facility. So we do a lot of work with groups and skill building for patients around things like cognitive behavioral therapy, dialectical behavioral therapy. And I'll oftentimes ask candidates about their knowledge or experience with the certain treatment modalities that we use. It is completely okay for a candidate to say, I don't know. However, if that's where you end the sentence, that doesn't give me a lot of assurances that you're motivated to kind of learn and develop within this role. So to say, I don't know is completely fine, but it's important to follow that up with, expressing a willingness to learn. How do you learn outside of work? What are your interests? What can you bring here? Even if it doesn't directly apply. So again, saying I don't know is fine as long as you're following it up with, but I'm really interested in learning more about that.
Okay, that's excellent. And one of the things I know that I've always heard about in interviews is personal appearance. And I'm assuming that still counts a great deal in interviews.
Absolutely. And it's funny, I was going to jump on that one as well. So another thing is just poor professionalism. I've seen people show up to interviews, and I'm talking your regular professional interviews with cut off shorts and tank tops. And I've even been to job fairs where I saw someone come in with a bonnet. So, kind of learning more, even if you need to ask someone who's already in the field or do some research on what appropriate attire is for interviews, really important. And especially for Gen Zs, the Gen Zers are getting used to doing more of their interviews initially on Zoom. And Zoom is an interview. It is not the time to continue to, keep on your pajamas because you woke up late and your interview is in 10 minutes. You can't do that. You need to dress as if you were going to an in-person and present yourself in that way.
Yeah.
I completely agree with that as well. It's also something to be said about being on time and being punctual for interviews. Even if you are 10 or 15 minutes late, that doesn't give me the sense that you are really motivated for this position.
Yeah, absolutely. I totally agree. So, Gen Z is often described as tech savvy and values driven. How can they use these strengths to stand out in healthcare interviews? So, Alysia, did you want to start?
Sure. For me, I like it when uh, someone comes to me and they highlight their digital proficiency. I believe, especially in healthcare, you're going to use a lot of data. You're going to be experiencing usage of electronic health records, telehealth platforms, data analysis tools. So, what transferable skills, maybe from an internship or maybe from a course you've taken? I want to hear about that because this is, as you know, even the healthcare industry, we're ever evolving and we're involving a lot of data now and also using a lot of technology to do the things we need to do and to get done and to make sure that we provide the best patient care. So I would like to see that a candidate coming in has some type of proficiency.
Okay. And Darcy?
Alysia just nailed it on the head. That fluency and that ability to kind of work across different platforms and different mediums, because all of healthcare works with different EMRs, scheduling apps, different programs that are either built within the cloud or desktop versions, emails. These are crucial ways that we communicate across departments and for good patient care. And even those that, don't know about our specific EMR or these specific programs we use, just showing that you have some sort of fluency working across digital platforms is really important.
All right. I'm going to follow up with another question because I know that we all seem to be so reliant on our phones for as a form of communication. And so, I mean, as much as I admire those who are tech savvy, I'm wondering if that can be not a disadvantage, but does it replace the regular form of communications? The dialogue, the back and forth between the interviewer and the prospective job applicant.
Absolutely not. I think it's a tool, but it can't be a crutch. So, one thing that I did a lot of as a recruiter, especially in Springfield, was I reached out to many of my candidates by text, which was fine. We had an application in our tracking system where I was allowed to do that. But then there's a time where we need to now pick up the phone. We're not going to have a text interview,
Right. Yeah.
we're not doing that. So, I believe that the Gen Z needs to learn how to actually incorporate both, but being appropriate with the usage of.
Hmm.
Darcy, what's your thoughts on that?
I mean, yes, I completely agree. And I also like to add that living in a rural area such as ours, where cell service, Wi-Fi accessibility can be sketchy at best, it's really important to know that you can't just rely on a cell phone or a text or what have you. You need to be willing and able to pick up the phone and kind of take the next step.
All right. And for those without much clinical experience, how can new graduates effectively highlight transferable skills or coursework during interviews? Darcy, do you want to start with this?
Sure. So most hiring managers understand that new grads have to start somewhere. You're not going to start every job with experience, no matter where that experience might be applicable to. So if you don't have that clinical experience, being able to highlight certain times where you have demonstrated motivation to learn, being willing to learn from those that maybe are veterans in this particular field, kind of coming in feeling like I have one day and I should know everything doesn't give us that confidence that you want to continue to learn. So yeah, I think, certain projects that you've worked on in school, certain experiences you've had where, you may not have had the actual book work or physical experience, but you took some due diligence in order to take other skills to apply to that. It's a lot of flexibility and just openness to learning. And that's also really important to us.
Alysia,
Yes,
did you want to
actually,
comment?
absolutely. Darcy, I love that answer, and that resonates with me a lot. What I love about my position here with Southern Area Health Education Center, or Southern AHEC, is that, Southern Vermont AHEC, I'm sorry, is that I am able to go into schools and have those conversations with high schoolers and say, hey, I understand you're, let's say, for example, you're interested in going into the mental health field. Let me connect you with someone I know, Darcy, and let's see if we can have a conversation so you can understand more about what is needed. Now, let's see if you're really interested, we'll provide a shadow opportunity. And I think shadow opportunities are so important. I have a high school student now that I'm working with who will be doing a shadow in diagnostic imaging to see if that's something she wants to do, because it's important to explore and understand what it is and what skill set you're going to need and what further education you might need. And then the shadowing can lead to that internship you need to build those, at least an awareness of what you'll need clinically. And then you go on from there. So yes, I think there are so many different avenues in which you can gain that.
I think you're spot on with that, Alysia. Do you see more hospitals and FQHCs providing more of these opportunities to students? I know many of them are understaffed and overworked, and so it's hard to spend some quality time with a student that might want to pursue diagnostic imaging or laboratory science. So do you think that the hospitals are going to be more flexible going forward with that?
I think it's a case by case basis, and it depends on how you're framing it. If it's going to be something that's going to help both the student and the hospital in the long term, I see the hospitals will figure it out and make the investment. So, for example, the individual high school student I was referring to, this is a potential person who will come and work at the hospital. So, for the director, for myself, and even for the student, it makes sense now to have that shadow, to have a potential some type of maybe internship as this particular student goes from 12th grade now into some tech school to learn what she'll need to learn to actually come and work at Springfield Hospital. So in those cases, that makes sense. I feel if it's something that's just going to be short term, it's more of an exploration, then I am fully aware of how understaffed a lot of departments are at just in rural Vermont, rural New Hampshire. So I'm not going to take that time away from that department. But what I'll do is maybe, hey, can we do a short shadow and then plan something later? Like we have the Governor's Institute of Vermont, which allows us to have a certain age range of kids, usually middle school to high school, to come in and experience what healthcare is all about as far as pathways. Maybe that's an avenue we can use for now until we can figure out something that's more substantial as the student figures out what they want to do going forward.
I know that some schools do have more of a prescribed, internship, year-end studies programs in place that are enable students to be able to experiment and explore. But I think you're right. I think people do look at it on a case by case basis, and that does make perfect sense because it is an investment. It's an investment of
Right.
time and money and resources,
Absolutely.
and you want to be able to get that return on investment. Darcy, did you have anything you wanted to add to that?
I think from the standpoint of a psychiatric unit, high school students wouldn't probably be the best use of resources only because, we do require, as far as a nurse is concerned, at least an LPN, though that's not every psychiatric unit, that's just our staffing dynamic. But we have worked with and are currently working with a variety of nursing programs where we are hosting LNA students, we're hosting LPN students. We just started a clinical rotation for somebody who's becoming a psychiatric nurse practitioner. When that one ends, we have 2 more following up on that. We have hosted PA students. So we do a lot of student teaching where we're able to. And I think the bigger the unit you are, we're a very small, intimate unit in Southern Vermont. But the bigger the unit is, kind of the more opportunities they are able to provide for a variety of students in a variety of different places within their educational career. But teaching students is huge because a lot of students will leave our facility never having had an experience in a psych unit, but loving the experience that they had. So that's all that we want to do, is kind of provide that outlet for them.
All right, very good. So, what role does emotional intelligence play in healthcare interviews, and how can Gen Z candidates demonstrate it effectively? Alysia, did you want to jump into this one?
Ooh, emotional, yes.
That's a big buzzword
So,
now, emotional intelligence.
I know. So I feel that it is it's a soft skill. It's a soft skill, but it's an important skill. So to demonstrate emotional intelligence, I see that mostly in teamwork, problem solving, and just being able to be empathetic. So when we're talking about working in teams, I believe a lot of that skill set, you're going to see it. You're going to see who has it, and you're going to see who doesn't and who needs work. And it's really about thinking of your teammate, how you're communicating. Just because you might think somebody understood what you said, they might have taken it a different way. You need to be able to understand that, be empathetic, and now have that conversation with your teammate and be able to work together. And I think that's part of having that emotional intelligence, is to know when to do that and how to do that effectively, because it is a soft skill, but it's a skill that is highly needed, especially in healthcare.
No, I totally agree. And Darcy, what are your thoughts on that?
Oh, I want to jump all over this one.
I knew it.
Uh, this is hugely important. So my personal background is I have a master's in counseling psychology. I am professionally trained as a therapist first and foremost. So when somebody comes into my office, this is kind of what I'm reading, is their ability to set boundaries, to demonstrate empathy, to be able to not emotionally internalize situations, but almost kind of safely and effectively detach, especially when you're working with psychiatric patients. Um, the other big piece that Alysia touched on too is showing that you have a propensity for collaboration and teamwork. If you are so rigid where you know the steps of the day-to-day situation that you need to perform, but lo and behold, because we work in healthcare, some unforeseen situation arises and you are not able to adapt cohesively to a situation that you weren't expecting, that's going to cause a lot of problems in any healthcare industry, in any sort of job role. So being able to show that you are adaptable, you are able to set boundaries, you are able to kind of move and ebb and flow within your job role and be part of the larger collaboration of the unit, that is absolutely key.
Well,
Absolutely.
I totally agree with you. And I think people are placing much more emphasis on emotional intelligence. I think people think you need to have the other form of intelligence, you know, the scholarly background. But emotional intelligence is huge. And I think it's important for this age group to understand that and be able to demonstrate it. How important is it for candidates, and we've touched on this before, to research a hospital or health system's values and culture before an interview, and what's the best way to bring that up during the conversation? So I know we talked a little bit about it in the beginning, but we can certainly touch on it again. So, Alysia, did you want to take this one?
Absolutely. So I find it very important for self-reflection. I feel as if being a Gen Zer, sitting now, one thing I love about Gen Zers is I know that they're very good at reflecting and thinking about things and meditating. Well, you better meditate on this because this is your future. What aligns with your mission? What is your personal mission? What is something that means the most to you and will get you up in the morning to go to work, even when you don't want to? Your culture and your value systems need to align with the employers. So, for example, if your mission in life is to work in a small children's hospital in Seattle, maybe Dartmouth, as far as a bigger university, not saying Dartmouth itself, but a bigger university might not be the place you need to be because you want to be in a smaller place on the other side of the country. So, thinking about where you want to be, what your values are, what is your personal, I have my own personal mission statement I wrote out when I graduated from school, from college. And that really helped me align what I needed and wanted in my employer and in my job and in the company I aligned myself with because I knew what I wanted and what was going to make me feel passionate about what I was doing. So I feel that's very important.
All right. And Darcy, what are your thoughts?
I agree with Alysia. I think that, you know, no hiring manager expects somebody to come into the office knowing, you know, the stats of that unit, the, you know, intricate histories of that unit. You know, we don't expect you to know everything about us, but I mean, know that we only treat adults. We don't treat children. Know that we, you know, are part of Springfield Hospital and we are a small rural community hospital which treats, you know, this Springfield area, you know, and the two southern Vermont counties. It's important to know that and to illustrate the advantages of working for a critical access hospital. Um, you know, that, you know, you might not have that long of a drive, such as if you worked at Dartmouth. But you also are not seen so much as a number because we are so small. It's much more intimate. You can give back directly to your community. There's a lot of benefits for working for a small rural community hospital. And I think illustrating that during an interview is really important.
Do you think that that it would be beneficial for a student, a graduating Gen Z, to formulate their own mission statement just
I
on their
think so.
own?
I feel that yes, because you need to think about what it is you want to do. You went to school for 4 years. What was the purpose? What do you want to do? You have to sit down and figure out. I can't, as a recruiter, tell you what you want to do. I can't, as a recruiter, tell you what your goals and aspirations should be. That's something I believe that's a personal thing. But from that point, when you kind of figure out, and a mission statement is nothing long. I mean, a good one's about what, two, 3 sentences. Once you get that on paper, and it doesn't have to be perfect or something you're going to publish, then now think about talking to others that are in the field that you want to go into with the knowledge of what you actually want to do and aligns with what your mission and goal is.
Do you think that there's not enough in on the college level? There isn't enough discussion about this in the college on the college level among instructors and students, or students with one another, or even career counselors on the college level about doing something like putting together a mission statement?
I think it varies. I think some schools emphasize it. I know schools that do, and some don't. And I think those that do not currently really should think about doing that, because I feel like it is helpful, especially when we're talking about careers, for these graduates to have some sort of compass, some sort of personal compass. Because one thing about Gen Zers, they want to do what aligns with their personal mission and goals. That is so important to them. So if that's important to them, that's something that should be a thing that's taught, maybe even a few minutes during a career class on how to do that.
Darcy, did you want to respond to this?
Um, and it may not have to be as, formal as, your own mission statement, but you do need to have an idea of, what makes you stand out, what is it that you're able to bring to the table, and to really use that and take advantage of that when you're trying to essentially sell yourself as a candidate to this company. What makes you different? That's really important, and that's kind of what we're looking for in order to promote the cultures within our own relative departments.
Very good point.
Yeah, agreed. What are some red flags or positive signs Gen Z candidates should watch for during the interview process to evaluate whether an employer is the right fit? Alicia?
Sure. Lack of clarity. I feel as if you go into an interview and things are very vague, job responsibilities are vague, expectations are vague, the organizational goal is vague, there's disorganization, there's poor communication, you might want to rethink going forward with that company. And another thing that's really important and deserves a discussion is high turnover rates. Now, high turnover rates can happen for a variety of reasons. So it's not necessarily a red flag, but it's something that should be discussed. It could be because a unit has decided to do something different within that particular unit and offer something that might be more, I don't know, needing more technical skills, and they had a lot of people who retired or were in retirement age and decided that wasn't for them. And that's why. I mean, there are different reasons. But if you just see the same thing happening, and it's happening a lot, and then you see there's poor working conditions, and then you have to think that through.
Right. And Darcy?
Um, I completely agree. I think there's a lot to be said about first impressions when you walk into an interview or you walk onto a unit. And I think just kind of quote unquote reading the room. So look at, the vibes that the manager is kind of sending out. Does it feel very stern? Does it feel very rigid? Does it feel relaxed? Does it, are your questions getting answered? Is there some transparency there about, we're looking for this. We've struggled hiring for this for these reasons. And I think again, it's just a lot of reading the room in order to get a sense of, no unit's going to be perfect, no organization is going to be perfect, but is this kind of a culture that you can get behind? And if not, trying to mold yourself to a culture that you really don't see yourself fitting into is not going to work out well for anybody.
I think this is where emotional intelligence plays a very important role.
Absolutely.
Yeah. Yes.
So this is probably the number one question for a lot of job seekers, but what are your top 3 tips for building confidence and reducing anxiety before a healthcare job interview?
Yes. Okay. Thorough preparation. If you're not prepared for your interview, you're going to be nervous to begin with. But if you're not prepared and those questions start flying at you, you're really going to be nervous and it's not going to feel good. So have a mock interview with someone you might know who's in the industry, or even with a friend or with a mentor. Practice what you're going to say. Make sure you did research the organization. Understand the hospital or the healthcare system that you want to go into. Look at recent news reports, talk to key personnel, and also practice common questions. Like the basic one that's always asked is, so tell me about yourself. When I ask that as a recruiter, okay, tell me you have a pet dog named Fido. That's wonderful. But I don't want to hear more about what school this dog is going to now and how you plan to, buy another horse. That's great. I want to know that a little bit about yourself and now tell me why we should hire you. What skill sets are you going to bring to the team? And another thing that I feel is important when asked these questions and something for people to practice is what's called the STAR system. So situation, task, action, result method. So that's if you structure your answers like that. So the situation is, I might ask, tell me of a time where you had an issue with your coworker. Situation, I had a time where me and my coworker didn't agree. We were working on a project that had to be done in 5 hours. She thought we could do it in 2. I didn't agree with that. Action, we both agreed to just work within a certain perimeter that we both felt would work. Result, we had a wonderful project where it made us the top place to work in Vermont. So if you can remember the STAR method, and this could be looked up on the internet too, very helpful in interviews and in preparation.
All right. And so, Darcy, I'm sure you've got something to contribute to this.
I do. Yes, I mean, being prepared for the position that you are applying for, sadly, is something I see a little too often with certain hiring sites that you can just kind of go down a list and just very quickly apply to multiple jobs without looking at the job it is that you're applying for. Can throw off some red flags about what your true priorities are when you're in the interview with a hiring manager. The other thing that I like to tell folks is that, being genuine is extremely crucial because interviews are built up to be anxiety inducing when they really don't have to be. I want to see, the genuine, true person sitting in front of me because that person is the person I want to hire. That's the person I want to see on the first day of orientation. We're all people. We're all, just trying to do our day-to-day thing. And we, as the hiring entity, are getting interviewed by you just as much as you're interviewing us. So it's important to be genuine, and it's also important to come with questions that don't have to do with the financial aspect of the position. I always ask folks when we're about to wrap up, do you have any other questions? And if the only question they have is having to do with incentives or rate of pay or differentials or what have you, I'm going to get the sense that you're not here to provide excellent patient care. You're here, for the fiscal aspect. So, if it ends up moving on to the next step, don't worry. The hiring manager will have that rate of pay conversation with the candidate. but it's important to not make that the top priority and true highlight of an interview.
And Darcy, to add to that, I would say as well, like, don't come in with not having any questions at all.
Correct.
That drove me as a recruiter crazy, because I'm like, we had all these people prepare time for you. The least you can do is think through 3 questions that will help you evaluate whether or not you want to work here, and to show us that you're really interested. So I totally, wholeheartedly agree with what you're saying.
Do you, as hiring man, both of you have, been involved in the hiring process. Is it okay if somebody admits that they're nervous during an interview, or is that not a good thing?
Yes, please tell me you're nervous. I think it is a very good thing. It shows me that you're transparent and that you're human. Yeah, I think it's a great thing.
Okay. So
And I actually prefer when somebody is just very upfront. Again, that's being genuine to yourself. I prefer that level of transparency and honesty, because if you weren't even a little bit nervous, if this were a job that you were really, really hoping you'd have an opportunity for, I'd be a little concerned if you weren't a little bit nervous. So yes, saying that you're
Exactly.
nervous,
Yeah.
absolutely okay, and actually welcomed.
Yeah.
okay, great. So what are some of the best practices for job applicants to follow after the interview?
Please say thank you. Just say thank you. I mean, it just boggles my mind at how many times, and I don't think candidates understand the logistics of getting an interview together, especially when we're talking about, you've spoken with me as a recruiter, now you're going to the hiring team. The logistics, the time that the managers need to carve out, that they might have to postpone a meeting, or, whatever. We go through all this, and then not even thank you email. I mean, within 24 hours, at least send a thankful email to your team. Know who your team is. You can ask, hi, or email whoever set up the recruiter. Hi, I just want to make sure I know who was on that team that I just interviewed with. May I have their email, or what have you? Or even if you want to send the email of thanks to the recruiter, to have the recruiter send it to the team, fine. Send something. And this shows your enthusiasm, and it helps keep you top of mind for the interviewer. And make sure that you personalize it. And oh, please proofread it. Thank you.
All right, Darcy?
And that was pretty much my biggest one is, follow up with the manager. My personal take on, trying to go through candidates is I reach out in multiple ways. I reach out using email. I reach out via phone. I can reach out using the hiring platform that we use. But typically, if you're going to have most of my contact information, and a simple thank you, and I'm really looking forward to hearing from you, and so on and so forth, that goes a long way. When we may have 12 candidates for the same position, showing how interested and how thoughtful you are about this role ends up helping to stand out a little bit. I also do want to say that, if we do schedule something and you're not able to make it, letting me know ahead of time is always helpful. But if I try to give you, 2 or 3 phone screenings and I keep getting ghosted each time, that's that's not gonna help my motivation to keep reaching out to you, even if on paper your resume looks excellent. So it's keeping in touch with the manager, following up, and when I say please reach out to me if you have any questions, I truly mean that. I think most managers do that, kind of offer that follow up after the fact, but staying in touch, even after the interview is really important. It does kind of highlight your interest in the role.
I think that Gen Zers and anyone applying for a job, I think it's always important for them to realize that this is a huge, huge process. It is not a one and done,
Yeah.
and you are interviewing with teams of people. It's not just one person who's making the decision. And I've learned that through the years, just in my own job interview experiences, that you have to connect with the team as much as the one person who may make the final decision. Both of you were tremendous today, and you shared some very, very important information that needs to be repeated again and again and again. And I thank you both for joining me here today on the Southern Vermont AHEC Let's Talk podcast. If you're a recent college graduate stepping into the field of healthcare, remember your education gave you the knowledge, but your mindset and preparation will set you apart. Be authentic, be curious, and don't be afraid to show how your values align with the organizations you're applying to. If you've enjoyed this episode, please share it with a friend and leave us a review. And you can listen to our podcast in a number of places. So until next time, stay focused, stay kind, and keep showing up.